is a history in the mom of being intoxicated, or in fact elevated levels in family members, she should be screened for lead in the pregnancy. In New York State, they are looking at first prenatal visit. I'd like to suggest to folks, especially to the pediatricians out there and those that are seeing the women for their gynecologic annual checkup, that this be explored earlier rather than waiting until they become pregnant. It's also an entree to explore other occupational and environmental exposures. So please don't forget that lead is critical to eliminate, but so are these other exposures, and that conversation needs to occur early with the pregnant woman. What we often find out is the highest levels are not due to a home environmental contamination necessarily, but an exposure to a very high source of lead. And we have found that certain Ayurvedic medicines or medicines from other countries that aren't prepared under standardized conditions are major risks along those lines. Some herbal products that are contaminated can get them higher. Also, we have products that are exposures via inhalation that can be. And so a conversation with the patient to identify what potential risks are. A number of them have been cosmetics, especially imported cosmetics or hair products. We especially see these in Asian countries where people are coming in and have contaminated with lead the very bright eyeshadows and the rest, and their levels can be well in excess of 25 micrograms per deciliter. We also have hair products, hair coloring, that is used in other countries. Here in the US, they're much more standardized and lead cannot appear in them, but families that immigrate here are at risk. In many instances, we're concerned about immigrant families from the types of products they commonly use, the fact that in their country, leaded gas is there, and their blood levels are already elevated to 12 to 14 micrograms per deciliter. The other part of it is the contamination of foods. And in some countries, the salsa that is made that people enjoy so much, it has a little sweeter taste to it. Why does it have a sweeter taste? Because it's made in a container that has lead in it, and lead provides that sweetness, and they've adjusted to that. And this has been seen in South American countries for people that have immigrated here, Central American countries. So the food source, and we identified that in New York City a number of years ago as a reason for the very higher elevated levels, not just modest ones. So our concern is when we see an immigrant family with elevated levels, is it something continuing based on their unique exposure, or is it something they've brought along, i.e. it's in their body? If it's in their body, we may have a problem a little later in pregnancy also, because the lead leaches out of the bone as calcium is required for the fetus and isn't sufficient often in the diet. So one of the things practitioners should keep in mind is that calcium supplementation, even earlier, if you know someone has grown up in a country with higher lead exposures, may be quite appropriate to reduce the amount of calcium loss from the bone, and at the same time reducing in the second and third trimesters the release of that lead, and potential exposure of the fetus. In the first trimester, first visit, let's find out if they have an exposure to lead. The questionnaire is one, a follow-up lead test, blood lead, to see if it's elevated. Some physicians prefer just to go directly to the lead test to really determine whether there is or is not a risk. If you find a patient who has an elevated level, when I say elevated level, it's greater than 5, but especially if it's 15, 25, 35, etc., you need to go back immediately and do a second test. Therefore, you have strong documentation that this is an accurate value. And then follow that patient monthly to see if the levels of lead are falling, because the new levels of lead should be falling rather quickly. And over the course of time, if that rate in half-life is a green, you've managed to nail it and find that there is the source and you've eliminated it. If not, you come back and try again. We have moved people from different work jobs to other work jobs where the employer said, oh no, there's no lead in that environment and she'll be good working there. Well, what happened is she moved, and when we monitored, we found the lead levels didn't decrease. They went back and monitored that new area and found out, oh yeah, there's lead in that area. So constant vigilance when you've identified a patient and following those lead levels, following symptoms. And what we find is the levels less than 40 micrograms per deciliter in mom's blood have been suggested that women continue to breastfeed because of the benefit, and that the baby actually ends up with very little lead crossing even at those levels. So you can imagine at 5 to 10 or so, negligible or insignificant levels are crossing. This is because for all intents and purposes, the milk is not a good source of lead for the baby. And that is very fortuitous because we can balance the benefit and the risk.